Healthy gums are an essential part of a healthy smile and a sign of good health. Your gums help protect the roots of your teeth and the bones in your jaw. If you notice that your gums are swollen, bleed easily, or are inflamed, it may be a sign that you have gingivitis. Hi viewers, and welcome back to Bestie. Gingivitis is a form of gum disease that occurs when plaque builds up on the teeth and causes inflammation around the gums. It can even lead to more serious issues like tooth loss. Statistics show that 3 out of 4 Americans will experience gingivitis at some point in their lives. Still, the good news is that gingivitis is treatable and preventable by incorporating good oral hygiene practices. In today's video, we'll tell you everything about gingivitis, from its symptoms, causes, to treatments, and more. Watch until the end to learn about all of them. Okay, let's begin by telling you what exactly is gingivitis. Gingivitis is an early stage of gum disease appearing as inflammation of the gum line. If it's left untreated, it can progress to the point of being detrimental to the strength and health of the bone that supports and surrounds your teeth. Plaque is a soft, sticky, colorless film of bacteria that forms on the teeth and gums through a combination of leftover food particles and saliva. If the plaque is not removed by daily brushing or flossing, it produces toxins that can irritate the gum tissue, which can then cause gingivitis. Because the bone and connective tissue holding your teeth in place aren't yet affected, the damage to your teeth and gums can be reversed at this early stage. If gingivitis is not treated, your condition may progress and become periodontal disease. This can lead to permanent damage of your gums and your teeth. How many times do you brush your teeth every day? Let us know in the comment section below. Moving on, let's talk about what causes gingivitis. Improper oral hygiene that allows bacteria in plaque and calculus to remain on the teeth and infect the gum line is primarily the cause of gum disease. But there are other factors that increase the risk of developing gingivitis. These are: number 1, smoking or chewing tobacco prevents the gum tissues from being able to heal. Crooked, rotated, or overlapping teeth create more areas for plaque and calculus to accumulate and are harder to keep clean. Number 2, hormonal changes in puberty, pregnancy, and menopause typically correlate with a rise in gingivitis. The increase in hormones causes the blood vessels in the gums to become more susceptible to bacteria and chemical attack. At puberty, the prevalence of gingivitis ranges from 70 to 90%. Number 3, cancer and cancer treatments can make a person more susceptible to infection and increase the risk of gum disease. Diabetes also impairs circulation and the gum's ability to heal. Number 4, bad habits like excessive alcohol negatively affect oral defense mechanisms. Stress can also impair the body's immune response to bacterial invasion. Mouth breathing can also be harsh on the gums when they aren't protected by the lips. This can cause chronic irritation and inflammation. Number 5, poor nutrition such as a diet high in sugar and carbohydrates and low in water intake will increase the formation of plaque. Also, a deficiency of important nutrients such as vitamin C will impair healing. Number 6, medications such as anti-seizure medications increase the risk of gum disease. Infrequent or no dental care and poor saliva production are also risk factors for gingivitis. Have I caught your interest? Well then, hit that subscribe button and watch more videos. Join our millions of followers for more amazing Bestie content. So, what are the symptoms of gingivitis? Number 1, red swollen gums. That's one of the first signs your gums need attention. Gingivitis typically starts with inflammation along the gum line. They may also feel tender or painful and bleed easily when you floss or brush. Number 2, bad breath. Your mouth is a nice, warm, and wet home for millions of bacteria. They feed on plaque, so the more of that you have, the bigger the buffet. Bacteria release toxins that can irritate the gums and teeth and have a foul smell. It's an important symptom of gingivitis. Number 3, receding gums. Take a look in the mirror and see if you can spot any receding gums. This is when the gum begins to draw back from the teeth, which exposes the root beneath. You might be able to spot that your teeth look a little bit longer or feel a notch where the gum meets the tooth. Receding gums are relatively common. If you can spot them, then it's time to find the cause and what you can do to stop them from getting worse. Did you know that pain is often the way our body alerts you to a problem? But typically, gingivitis isn't painful. This can mean that it can be overlooked. Usually, painful, sore gums are caused by something else. maybe poor brushing technique, or a dental abscess. If you do have tender, sore gums, speak to your dentist to find out what's causing that problem. Number 4. Sensitive teeth. If a sip of a cold drink makes you wince, your teeth may be telling you something. That's a symptom of gingivitis that often goes hand in hand with shrinking gums. With receding gums, the sensitive part of the tooth is exposed. That's called the dentin, which causes sensitive teeth when exposed to cold water or air. Number 5. Wiggly or shifting teeth. Does your smile look a little different lately? Gingivitis can attack the bones that hold your teeth in place, making them loosen or move. Gum disease is the main cause, and it can even change the way your teeth fit together when you bite. Finally, here are a few home remedies for gingivitis. Number 1. Green tea. Regularly sipping on this herbal brew may help. Research has shown that green tea is high in antioxidants that help reduce inflammation. It can also counteract the body's inflammatory response to bacteria in the mouth. Green tea also eases the swelling and bleeding from gingivitis. The polyphenols in green tea may also help inhibit the growth of bacteria that can lead to gingivitis. Not just for your teeth, green tea is a boon for your whole body. Learn more about its benefits for you by watching Drinking Tea Every Day Will Do This to Your Body. Now back to gingivitis causes, symptoms, and remedies. Number 2. Lemongrass oil mouthwash. In one study, lemongrass oil was found to be more effective than traditional chlorhexidine mouthwash at reducing plaque and gingivitis levels. To use lemongrass mouthwash, dilute 2 to 3 drops of lemongrass essential oil in a cup of water. Swish the solution in your mouth for up to 30 seconds. Spit out the solution. Repeat 2 to 3 times per day. Food-grade lemongrass oil is generally safe to use, but it's very potent. Always start with a highly diluted mixture so that it doesn't cause further irritation. Number 3. Oil pulling. Oil pulling can reduce bacteria and the buildup of plaque that leads to gingivitis. Take 2 tablespoons of oil in your mouth. Swish it for 20 to 30 seconds. After spitting out the oil, rinse your mouth with warm salt water and brush your teeth. Number 4. Turmeric paste. This spice, typically used in curry dishes, is becoming increasingly recognized for its anti-inflammatory, antioxidant, and antimicrobial properties. Plus, one study found that applying a paste of 1 teaspoon of turmeric, half a teaspoon of salt, and half a teaspoon of mustard oil provides relief from gingivitis when rubbed onto the gums and teeth twice a day. Number 5. Salt water. Salt water is one of the oldest and truest old wives' tale remedies for gingivitis. Hospitals and dentists use it in the form of saline. It's easy to prepare safely at home and may help draw infection out from your gums. To make a sterile saline solution at home, boil 2 cups of water in a clean pot. Add 1 teaspoon of salt and mix well until the salt dissolves. Allow the mixture to cool. You can pour the mixture into a clean container once cool. Just be sure to use it or throw it out within 24 hours. The best way to use salt water to your advantage is to use it as a mouthwash. Rinse well, holding the salt water in your mouth for between 30 seconds and a full minute, and then spit. For gingivitis, try to rinse with the mixture between 5 to 6 times a day. Number 6. Aloe vera. Aloe vera has a long history of treating scrapes and burns on the skin, but it's proven to be useful in your mouth as well. Research has shown that aloe vera is just as effective as commercial toothpastes at reducing disease-causing bacteria. Aloe vera has also been shown to help healing after gum surgery. Application with gel may result in better initial healing and reduce discomfort. If your gums are sore or swollen, you may notice relief with aloe vera. There are over 300 species of the plant, but only a few of them are used medicinally. It's important to use the right type and make sure it's 100% pure. If you're using a rinse, swish for 30 seconds, brush, and spit. You may also directly apply a gel and gently massage around the gums. Number 7. Baking soda. Sodium bicarbonate, better known as baking soda, can be an effective ingredient to use your teeth and gums. It works against harmful mouth bacteria and also neutralizes acids that cause inflammation and damage of the tooth surfaces. As an added bonus, it breaks down stains and can brighten teeth. You can make a paste by mixing a small amount of baking soda with water and gently brushing it onto your teeth. This slurry provides one method of cleaning, but it's important to include other antibacterial compounds as well. Number 8. Daily brushing and flossing. Brushing your teeth twice a day and flossing is still one of the best home remedies for good oral health. Removing plaque and disrupting bacteria that colonize the teeth and gums removes the primary cause of gum disease. Bacteria quickly reproduces in the mouth, so it's important to make morning and night cleaning a consistent effort. Gingivitis can be prevented if you take good care of your teeth. Learn more about how by watching 11 videos to strengthen your teeth or 13 foods to eat if you want beautiful white teeth. So go ahead and watch one or both of these videos for maximum benefits. Have you ever faced gum or teeth issues? Let us know in the comments below.